Revolution, your daily tonic for healthy living with yours truly, Mary, the Slim Diva, your most adorable. We are live on Facebook at Echo FM 100.7 and Echo FM ECHOFM. Go right now, like, and share the page, okay? The moment I drop questions, you begin to drop your comments as well. And do not forget that this program is sponsored by Eve Green Foods, a subsidiary of Eve Green Industries and Investment Limited. So later on, I'll be asking questions on our sponsor. Listen, whatever we play, whatever we say on this program, pay attention because I'll ask you questions. And if you win, if you get to answer correctly, you win yourself some packs of the products from Eve Green Foods. Okay, time to introduce my guest for today. Apologize, Dr. Amara. I know you've been on the line. Good morning to you, Dr. Amarachi Opara.
Good morning, Mary.
Yes, you're welcome. It's good to have you join us. How have you been?
I'm fine. I'm good.
Okay. Very well. Thank you. Dr. Amarachi Opara is the chairperson, women optometrist in Imo State and lead optometrist for Vision Matrix Eye Clinic. It's good to have you join us on today's edition of Health Revolution.
Thank you.
Okay, so we'll go straight up into the conversation. I had to drag Dr. Amarachi. I know she's always very busy, but I pleaded with her. And I said, you know what? The month of August is known as the Children's Eye and Safety Awareness Month. We have a lot of job to do, Because right now, if we did not take time, the children that we have, by the time they become adults, almost everybody will be wearing glasses. I know what I'm saying. So this is a very important topic, and I know that Dr. Amara is always passionate when we have to discuss anything that has to do with the eye. So our guest for today will help us with details on how to spot vision problems in young children. Okay, in few weeks, children will go back to school and resume a new section. They are at home as we speak at the moment. And you will agree with me that majority of these children have their eyes fixated either on the television or on their tablets or maybe on a laptop. They don't even care. All they know is they just want to see what's going on in all of those things. And you scream, you shout, please, leave that place. You're too close to the TV. You're too close to the tablet. They might not understand the language. So we will also try to explore the various complications that could come up as a result of this unhealthy practice. And that's why we have Dr. Amara this morning. Over to you, Dr. Amara. Why is this an important topic to discuss? Let's start from there.
Okay, thank you very much. August is known as the Vision Eye Health for Children Awareness and Safety Month. This is because it's assumed that in August, most children are on holidays and they have a lot more time in the house and more exposure to things that may not be safe for their vision. You have a lot of playing. You have a lot of household chores that they engage in. So it's a time that they may be exposed to things that may be harmful or unsafe for their vision or for their eyes. So the month of August is brought out as a month where we do eye health awareness for parents to help them to take care of their children, to help them to safeguard their children's eye health. So why is it important? Currently, you know that we have a lot of, we have a lot of digital screen time. You know, in our current dispensation, even when a child of less than 1 year makes a lot of noise, you will hear the parents just want to give him either cocomelon or one tablet or one phone to just keep that child busy so that they will not disturb their activity and they'll be able to do what they feel they want to do. Or you have parents giving children chores of things. Number two, you have children who are doing chores given to them by their parents, maybe to wash out the toilet or something with a chemical, and nobody is monitoring how they are using those chemicals, and you could have some harmful effects on their eyes. Number three, you are having children who also have like playtime with their fellow friends, and you may have accidental trauma to the eye. So the month of August, we use it to educate parents on the fact that the screen time should be reduced for their children. educate parents that when you send a child out to do chores in the toilet, in the kitchen, you have to monitor the harmful chemicals so that they don't mistakenly splash it on their eyes, and you will have to start running helter-skelter for it. We also use the time to educate them for toys that may be harmful, how to keep safe the toys that the children will use so that you won't have trauma due to accidental trauma due to playing around. And then to also educate them to watch out for signs, because in August you have more time actually to stay in the house with the children, okay, or for them to be in the house in theory, right?
Yes.
So you have more time for monitoring. They are not spending more time in school, they are spending more time in the house, where you can observe their behaviors, observe their actions. You observe if your child is having any visual problems. We also educate parents on vision problems to look out for, symptoms, signs to look out for. I'll tell you, okay, this my child is having some issues with his sight, because remember, vision is 80% of what we learn. Without the eyes, most times your child may not do well academically or in other aspects of life.
Yes.
So it's what they see that gives the information that helps with growth in any other area that they are going to develop. So it also helps you to be able to detect visual problems on time and be able to take them to the appropriate eye clinic or the appropriate person for a review. So August is an important month for what we call, in Nigeria here, we call it the back to school season. So, but around the world is known as the Children's Eye Health and Safety Month. Okay, so we use it to help parents to know more of what they should do for their child's vision.
Okay, well explained. So you already mentioned that it's a time for people, especially parents, to try to detect visual problems on time. Help us with some of these common visual problems that children mostly have, and most times we do not pay much attention to them.
Okay, so you know, in this part of the world, especially in Nigeria, most parents feel he's a child or she's a child. She shouldn't have any vision problems. Or what are they looking at that they should be having vision problems?
Yes.
In fact, I've had parents that will come with a child and say, but I just brought him so that we'll just check, but she shouldn't be having any problem. The truth is that some of the things that affect the eyes actually show up on time, okay? So you could have a child, there are different levels of developmental vision development that we should be watching out for as a child is developing, okay? But one of the signs to look out for when a child is less than 2 months or when a child is born, you will have the doctor check the eyes with what we call for light sensitivity and reaction. They are checking the pupillary reaction of the child. They are checking for if there is any abnormality in the eye. That's at birth and less than 2 months. From 3 months to 6 months, they are checking for the child's ability to recognize light. You know, when you put on lights, they will blink or all those things, and when they hear sounds, the eyes tend to move around. From 6 months to 2 years, 1 year, 2 years, your child should be able to track objects, should be able to see things and follow. You should be able to tell colors. All right, when you show blue, red, all those shiny colors, you see them, they want to grab it. Like if you're carrying a child of 6 months to 1 year, you see they want to grab your shiny earring, they want to grab your shiny glasses. Okay, so when a child is not doing those things at those levels of development, it's time to worry. You're also checking for the eye movement. Are the eyeballs looking straight? Are they looking as if they are deviated? By deviation, I mean that it's looking as if the eye is pointing maybe towards the nose or towards the ear. Right, you are checking also if the child can follow. Maybe when you move left, move right, the child is following those things. So you're checking for the eye development. From 3 years and above, you know the child has started moving around. So you're checking, are they knocking down when they walk around? Are they when they see objects, maybe an obstacle, instead of avoiding the obstacle and going around it, maybe they are being knocked down by it, right? Because your child has started walking around, running around. Maybe when you are walking, they want to follow you and all those. So they should be able to see obstacles in front and be able to avoid the obstacle. But if a child is having maybe some